Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do you have a Medicare Part B or Medicare Advantage plan? If you do, then you are eligible for a free yearly Medicare wellness visit. Joining us to talk about this is Kaitlyn Bertrand. She's a physician assistant with the Scripps Annual Health Assessment Clinic. Thanks so much for joining us.
Thanks for having me. I'm really excited to talk about what I do at the Annual Health Assessment Clinic, which is a standalone clinic offered by Scripps Health, and we partner with your primary care doctor's office to perform annual health assessments like your Medicare wellness visits.
So, what is this Medicare wellness visit?
Well, a Medicare wellness visit is an annual health assessment that we complete yearly, and it's to develop or update that personalized care plan to help prevent diseases or disabilities based on a patient's current health and risk factors.
This has to do with healthy aging.
That's correct. Yeah, we're all about healthy aging for the life.
And so, who is eligible to get this?
Any patients with Medicare Part B or Medicare Advantage are eligible.
And how often can you get it?
Medicare wellness visits are offered yearly for our eligible patients.
So what happens if something changes, though? Let's say your medication changes, or let's say you have some major event during the year. Let's say like you have a heart attack or a stroke. Can you go back and update this wellness visit?
Well, the wellness visit is once per year, but we encourage all patients anytime they have any major medical changes to go ahead and follow up with your primary care doctor's office so that we can get, you the correct care that you need and make sure that your medical chart is accurate.
And how does the patient prepare for this visit?
Before the visit, the patient is going to receive a series of questionnaires that they can answer either over the phone with one of our clinical staff members, or if they sign up through MyScripps, they can do that at myscripps.org. It's also going to be helpful to have an updated list of any medications you're taking or supplements and any outside vaccines you've had at your pharmacy.
And so what actually happens during this annual wellness visit?
During the annual wellness visit, you're going to have your height, weight, and blood pressure measured. We're also going to review your medical history and your family history. It's also an opportunity to update your current list of care providers, which are like any specialists, like a cardiologist for any heart conditions that you're seeing, if you have a dermatologist, and to make sure you have your correct primary care doctor on file. We're also going to do some screening tests and questionnaires to see if you're at risk for developing any memory difficulties or behavioral changes. We'll check to see if there's any mobility problems, to see if you're at higher risk for falling. And this is also an opportunity to review any advanced care planning, which is like your end of life choices.
And these can be real tough conversations to have, right?
Yeah, they are hard topics, but at the end of life, if you're incapable of making those decisions, maybe you've had a major medical problem like a heart attack or a stroke, and you're incapable of making that decision for yourself, it's important to have that conversation ahead of time while you're still healthy.
And you also talk about depression and isolation with these patients, correct?
Exactly. We find that a lot of our elderly population struggle with depression and isolation, especially after our pandemic.
Or maybe someone in their family has also passed away.
Yeah, definitely.
And these, as I said, these are hard conversations to be had, but they are conversations that really need to take place.
Exactly. And that's why we really encourage patients to come in for these Medicare wellness visits, because it offers us an opportunity to have those hard conversations.
And once again, to emphasize, this does not cost the patient anything.
Exactly. This is a free service offered by Medicare.
So how does this Medicare wellness visit differ from an annual physical exam?
Well, during a Medicare wellness visit, there's no head-to-toe physical exam component, but this is an opportunity for us to review your medical chart in its entirety, as well as to update those preventative care screenings that you may be due for.
So you're not going to draw blood. You're not going to send stuff to the lab for testing.
Any topics that are not under the Medicare wellness visit may have an additional fee associated with them, so it's important for patients to remember that. But if there are preventative screening tests that you're due for, like a mammogram or a bone density scan to check for osteoporosis, we'll screen you for things like colon cancer. Those things are covered, as well as your routine vaccinations.
So if a person comes into this wellness visit and they have some medical issues that they want to discuss, maybe some heart issues or diabetes, maybe they had a stroke several months ago, maybe they need some blood work done, that does not happen, right, during this wellness visit.
Correct. Non-preventative topics are not covered under a Medicare wellness visit. This is, however, the opportunity to discuss health topics that aren't typically addressed during like a normal office visit.
And what if people need these tests? What if they need these conditions addressed?
Well, if the assessment is being done at one of our annual health assessment clinics, we're going to refer you back to your primary care doctor. If your primary care doctor is performing your Medicare wellness visit, they may want to just have you back for a follow-up appointment. It's important for patients to know that any issues discussed that are not a part of the Medicare wellness topics may have an additional fee associated with them based on a patient's benefit plan.
So why is this Medicare wellness visit so important?
Well, we really care about your health, and at Scripps, we really feel like we are your partners in healthcare. So by having any patients that are eligible for Medicare wellness visit take advantage of this free service, they're able to stay on top of their healthcare, identify any health risk factors, and complete those preventative screenings.
And so the whole point of this Medicare wellness visit is prevention. It's trying to prevent chronic conditions, to prevent things from getting worse.
Correct. Yes. Our plan is to develop a preventative care plan for the next 5 to 10 years. We can look for any signs of early disease and prevent certain conditions from developing.
And this annual wellness visit, can this be done over video? Can this be an e-visit so that you can do it from the comfort of your home?
Absolutely. Our care team specialists can determine which visit type is right for you, but most of our Medicare wellness visits can be done either in person or over video visit. They can't be done over the telephone though, however.
Is there anyone who is not eligible for this annual Medicare wellness visit?
Unfortunately, patients who do not have Medicare Part B or Medicare Advantage are not eligible for this type of visit.
If you want to schedule this annual Medicare wellness visit, what should you do? What are the steps you should take?
There are a few different ways to schedule a Medicare wellness visit. You're welcome to call on the telephone. The phone number is 858-678-6076. You can also go online to myscripps.org or schedule through your MyScripps portal if you've signed up for one.
Any final thoughts?
Yeah, we really hope that all eligible patients take advantage of the Medicare wellness visit as it is a free yearly service. This is so that we can better partner with you to optimize your health and develop that personalized care plan over the next 5 to 10 years. At Scripps, we really do believe that we're your partners in healthcare.
Thanks so much for talking to us. We appreciate you taking the time.
Thanks so much for having me.
If you want more information on this annual Medicare wellness visit, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.